Hi everyone, and welcome to another episode of the Fibroid Doc, where I share information with you to help women with fibroids live a life free of bleeding and pain. Now, this last month, I've been discussing fibroids and pregnancy. We did a couple of talks on that. We had a patient who had fibroid surgery during pregnancy come and share her story. We also talked with Dr. Packman, who's a maternal fetal specialist. So if you didn't catch those episodes, please go back and listen to those. They are super inspiring. And this month, I want to discuss fibroids and fertility or infertility. And there are two main things to think about when a woman who has a fibroid is trying to get pregnant. Now, I see a lot of these patients who come to my office for a consultation. Some of them have small fibroids or large fibroids, 1 or 2 fibroids, 10 fibroids, and they are thinking about getting pregnant. And others have had recurrent miscarriages. And when they've looked into why, they sort of figured out that, oh, I have fibroids, and now what can I do about it? So I want to break down this topic into two main categories. I've said this before, but when we think about fibroids, the two biggest factors to think about are location and size. So number one, size. Size truly does matter with fibroids, okay? So there can be a patient with a 4 or 5 centimeter fibroid, don't even really know you have it, not really getting any pain or pressure or anything like that. But it's just incidentally, discovered on an ultrasound or a sonogram. Now, when that fibroid gets to be larger, maybe 6, maybe 7, 8, 9, I just took out a fibroid that was 12 centimeters. These fibroids now can really start to put some pressure on the cavity of the uterus. And the cavity of the uterus is where a baby forms, where a baby lives prior to birth. And so you want that cavity to be nice and clean and, the shape to be normal. And if you've got a big fibroid that's pressing in, well, then you've got a problem. Either when you're trying to get pregnant, the embryo is not going to implant in that cavity because something is pushing against it, or it is more likely to lead to miscarriage, okay, because the cavity is all distorted and, something big is pushing on it. So size absolutely matters. And number 2 is the location. So you could have a 5 centimeter fibroid hanging out on the outside of the uterus, kind of just attached to the uterus, or you could have a 2 centimeter fibroid inside the cavity of the uterus. And guess what? That 2 centimeter fibroid is going to cause a bigger impact because it is right inside the cavity. It's going to cause bleeding. It's going to be in the way of an embryo being implanted, or maybe the embryo implants on that fibroid. It's going to cause a miscarriage. So that 2 centimeter fibroid has got to come out compared to that 4 or 5 centimeter fibroid that's sort of attached to the uterus, but not really in the cavity. So again, it's two main things, the size and the location. So this is what it's all about when we think about fibroids and fertility. And, if there are steps we need to take prior to actually trying to conceive. Okay, so we'll dive into these two topics throughout the month. If there are any specific questions that you have about fibroids and fertility, please comment below. Send me a direct message on Instagram at TheFibroidDoc, or you can always email me at TheFibroidDoc@gmail.com. And as always, if you're trying to conceive, please remember to take your prenatal vitamins. Okay, take care, everybody. Bye.